A very good afternoon, everyone, and respected judges. My topic is on blepharochalasi. The title of my study is the clinical profile and management of blepharochalasi in a tertiary eye care center. So, blepharochalasi is a rare eyelid disorder characterized by the acute attacks of inflammation and swelling of the lids, leading to destruction and distortion of the eyelid anatomy. It was first described by Beer and Dukes in 1817. The exact etiology is yet not known, but pubertal and hormonal changes may play a modulator role in the diseases. Histopathologic findings shows the loss of elastin and collagen fibers in the skin with positive for MMPs, and the recent report also shows there's immunoglobulin A deposits in the residual elastic fibers. So we did this study of so we described the clinical characteristic and management out of a case series of 10 patients that was diagnosed with blepharochalasi. So the total patients were 10 patients, out of which 9 were female and 1 were male, done over a period of 2 years, and it was observational studies. The inclusion criteria were the patients with history of recurrent swelling on and off, and adult patients with aponeurotic ptosis with hanging excess skin. Exclusion criteria were any major systemic illnesses such as diabetic mellitus and hypertension. So the main aim of the objective of the study was to study the clinical profile and management of the blepharochalasi. Okay, so some of the important clinical characteristics that I would like to highlight is the presence of allergic hypersensitivity, then significant ptosis, which is the moderate to severe ptosis, then lid skin changes, and the canthal dystopia and pseudoepicanthal fold. And there is one very important finding with the history of recurrent swelling. So the history of age of onset and of the symptom and the history of recurrent episodes were the most consistent finding in all these patients. Apart from that, the lid skin changes such as thinning and wrinkling and redundancy were also present. And half of the patients were having the presentation of ptosis, and the other signs include pseudoepicanthal fold, canthal laxity, and canthal dystopia also. Some of the other results were the quality of life of the surgery was also at the age of 1 year was assessed. So these are the skin changes, which includes lax, thinned, wrinkled, atopic changes, which classically gives appearance of a cigarette paper appearance skin. And then there is sometimes appearance of the visible blood vessels also. Then there is a presence of pseudoepicanthal fold. Then significant ptosis, which can be either aponeurotic or mechanical. Then the lateral canthal tendal abnormalities, which can cause a canthal dystopia and narrowing of the palpebral aperture. So the strong pointers from this study were the recurrent episodes of the acute swelling, eyelid swelling during the adolescent period. And the episode usually lasts for 24 to 48 hours with spontaneous resolution. Then thinning and redundancy of the skin with atopic changes with visible prominent blood vessels are also the important ones. Apart from the skin changes, there can be fat prolapse, which can be preseptal or orbital, or like gland fat prolapse, thinning or dehiscence of the levator muller complex leading into the moderate and severe ptosis. Then laxity of the lateral canthal tendon and narrowing of the palpebral aperture, both horizontal and vertical can be. So apart from the skin changes, the aponeurotic ptosis, canthal dystopia, and pseudoepicanthal fold were the important findings. So medically it was managed. There is a role in acute phase. During this management, rheumatologic evaluation is very important to rule out other causes such as sarcoidosis, and dermatologic evaluation is also needed. So the common medication that we used were antihistaminics, carbonic anhydrase inhibitors, NSAIDs, corticosteroids, and immunosuppressant. Surgical approach can be done during the quiescent stage. It is also become very important to rule out the OMG, CPEO, and trauma, and also to evaluate the patient for the neurology. So the common surgical approaches were blepharoplasty with tissue repositioning, ptosis surgery, and canthoplasty. So these are some of the cases from our study sample. So 24-year-old female with blepharochalasi showing the left eye laxity in the skin with severe ptosis with frontalis overaction and the contralateral lid retraction in the right eye was managed by ptosis surgery and blepharoplasty. The second patient, you can see the female in a quiescent stage with the skin changes, thinning, and laxity with normal lid skin. It was managed by observation and follow-up. Similarly, another patient of a 12-year-old female with blepharochalasi in acute stage presented with swollen both the sides of upper lid with causing mechanical ptosis and frontalis overaction, managed symptomatically. Then another patient with male patient with a history of recurrent swelling in over two decades, presented with bilateral blepharochalasi with severe ptosis and cigarette paper appearance of the skin, obliterating the lid crease and lid fold. So it was managed using surgical correction and blepharoplasty with the lateral canthal plication. So this was the case of a 25-year-old female present to the OPD, the recurrent swelling in the both eyes. There was no major systemic illnesses. Both eye visual acuity were normal, anterior and posterior segment within normal limits. So the surgery was planned was bilateral blepharoplasty with tissue repositioning under LA. So this was the patient, this was the pre-op picture, and the post-op correction we can see with very minimal lid scarring. So the final take-home message would be, it can act as a clinical dilemma. So it is important to rule out the other causes such as dermatochalasis, preseptal cellulitis, VLM, and other rheumatologic causes such as sarcoidosis and angioedema. An important cause of aponeurotic ptosis in young adults. The classical presentation described is a cigarette paper appearance, acquired ptosis, which can be aponeurotic or mechanical. And the surgical intervention in inactive phase is done, and acute phase for the medical management, and blepharoplasty, ptosis correction, and the tissue repositioning or the surgical approach that also improves the number of acute episodes and improves the quality of life. Thank you. Here are my references.
Dr. Shailesh, nice study. Where was this study done? In which institute?
So it was done in Dr. RP Center.
Okay. And how many cases you included in your study?
Yes, sir. So the total of, so over the period of 2 years, we found, diagnosed the patient for about 10 patients, sir.
Okay. So how are you deciding, like what was the time gap between the acute stage and your surgery? So when were you deciding that the patient is ready for surgery? Because this is a recurrent process.
Yes, sir. So the time becomes very important when we intervene surgically. At least the period of 6 months should not be any active phase in this. So in that case, if the patient is still complaining of the heaviness, then we can go for the surgery. Mentioning that at least 6 months of there should not be any activity in such patients, sir.
And you also talked about some syndromes. So did you find out what all syndromes are associated with this?
So as the number of patients is not, it's just 10 patients, so we are still, it becomes very important to evaluate the patient for like rheumatological causes such as sarcoidosis and other skin-related disorder which can present in the eyelid skin also. So that further needs more number of patients in order to evaluate in that direction.
So did you find out any systemic association?
Not yet, sir. We are continuing this study further, so maybe in the next for more sample we collect.
And what was the medical medical treatment you were using?
Yes, sir. So I said there is no established treatment, but there has been reports of using the short course of steroid, and also the topical immunosuppressant such as tacrolimus has also been used in the study. Yes.
Thank you.
How many cases did you have recurrence? 10 cases you followed up. So how many cases, do you have statistics of how many cases had recurrence in your 10 cases?
Yes, ma'am. So, ma'am, as our study sample shows that the patient gave the history of recurrence for like in 1 year, they have 4 to 5 on an average recurrence showed. And as the patient grows older, the recurrence doesn't happen that much.
You've not seen the patient again. I mean, have they come with recurrent episodes?
No, they have been following every 3 months, okay, including all the patients which underwent surgery and not just for medical treatment also. Yes, ma'am.
Thank you. Okay, thank you.
Thank you.